Now we're going to talk about some of these disorders that affect reading and writing ability. And the first one is called alexia without agraphia. Alexia refers to an inability to read, and agraphia refers to an inability to write. So in this disorder, we have a patient who cannot read but can write. In fact, one of the more striking things you'll see with these patients is that you can ask them to write a sentence on a piece of paper and hand it to you, and then you can hand it right back to them and ask them to read it, and they won't be able to read the sentence that they just wrote. So writing is survived, but the reading is impaired. The lesions that cause this type of disorder affect the visual fields of the left hemisphere, or the visual areas of the left hemisphere, and they involve the corpus callosum of the left hemisphere as well. And what happens is that the patients really can't see any of the written information because the left hemisphere visual area is damaged, and they have a homogeneous hemianopsia and typically a color anomia. Sorry, the right visual cortex is intact and they can see, but what they can't do is transfer that information over to the left hemisphere. So these patients cannot see the words. The left hemisphere controls spontaneous speech, so the left hemisphere isn't able to tell you what it can't see. You can access that information in a different route. So if you spelled words to these patients, they would be able to recognize the spelled words, but they just wouldn't be able to read the words from writing. So that's alexia without agraphia. The next syndrome that we're going to talk about is Gershman syndrome, and it involves agraphia, but it has other cardinal symptoms as well. Gershman syndrome happens after a lesion to the left hemisphere and to the angular gyrus, the inferior temporal parietal occipital area, kind of the junction or the coming together of those different areas. Gershman syndrome has 4 cardinal symptoms. One is agraphia, which we described above, that may or may not be present with alexia. They also have acalculia. Acalculia is an inability to perform simple arithmetic functions like addition and subtraction. Finger agnosia is another symptom. Finger agnosia refers to the inability to name fingers on the hand contralateral to the stroke. For instance, if you ask them to name their index finger, they wouldn't be able to do that, or to name their pinky or their middle finger. That's finger agnosia. And then the final symptom is right-left confusion. And this is not being able to tell the right or left sides of their own body, and not being able to point to the right or the left side of the examiner, for instance. So Gershman syndrome is a kind of a hallmark of neurology, and it's a good one to know for exams.
Yeah, I think it's a very testable factoid. I think every test I've taken in my medical school and medical training has included this at least once.
So this disorder called neglect is also referred to as unilateral neglect. It's also referred to as spatial neglect, and it's commonly thought of as an attentional disorder. Neglect is classically associated with lesions to the right hemisphere and of the right inferior parietal area in particular, okay? But the fact of the matter is that neglect happens after lesions to different parts of the right hemisphere as well. And the most typical patient you'll see would have a large stroke of the MCA that involves a lot of volume of the right hemisphere. The classic feature of these patients is that they're inattentive to stimuli contralateral to their stroke. So this would be on the left side of their body or in the left side of space. It's a pretty dramatic presentation. If you're examining these patients and you walk up to them on the left side, they may not even acknowledge your presence. But if you move around to the right side, they'll all of a sudden be aware of you. So it's that dramatic. These patients may not dress the left side of the body. They may not shave or groom the left side of the body. If they're eating, they may not eat from the left side of the plate. So it's pretty striking. The other thing that's associated with neglect is a disorder of arousal. When you see these patients, especially acutely, they can be very under-aroused and hard to kind of wake up to examine. And then if you don't keep talking to them, they can fall asleep. That resolves and gets better over time, but they still kind of have a persistent unarousal. The final thing I'll say about neglect is that these patients often have a disorder of awareness. So they may not be aware, for example, that they have a hemiparesis on the left side. If you ask them why they're in the hospital, they might tell you something's bothering their stomach, and they won't even acknowledge the fact that the left side of their body doesn't move. So again, it can be pretty striking. But it just goes to show you how important the right hemisphere is for baseline levels of behavior and how important arousal functions are for almost every other type of cognitive ability.